help to measure the change. Okay, if you want to measure something, then it is those variables which will help you to measure that. Okay, so indicator is used to measure the health status of a community. It is used to compare the health status of one country with that of another, for assessment of the healthcare need, for allocation of the scarce resources, for monitoring and evaluation of the health services. Okay, so here, for example, let's say if you want to see the change in the death rate. Okay, so suppose you want to see the infant mortality rate. So infant mortality rate is also one of the indicator of mortality. So when you see the infant mortality rate, okay, so at that time you see the status of the death of the infant in a particular country. But now when you compare the infant mortality rate of Nepal with that of India, okay, so let's say if the infant mortality rate of Nepal is higher than that of India, then you can say that the health status of Nepal is not good as that of India. Okay, so this is how the indicator will help you to know that. So here, okay, there are a lot of indicators of health. Okay, this is given in Park in detail. So here I'll be providing the note also, as I have been telling you. Okay, so here the indicators of health. There is a mortality indicator, there is a morbidity, disability, nutrition, healthcare delivery, indicator of quality of life, health policy indicator. So these are the various indicator. Okay, so can anyone tell me what is the difference between the mortality and morbidity? Any general idea? Can any one of you volunteer to say that? What is mortality and what is morbidity? Any one of you, please?
Mortality is related with the death rate and morbidity with the illness.
Okay, that's right. So whenever you are measuring the crude death rate, you are measuring the infant mortality rate, you are measuring the maternal mortality rate. Okay, so those all you are measuring the death, right? So if you are measuring the death of an infant, then that is infant mortality rate. If you are measuring the death of let's say the mothers, okay, the mothers who have recently given birth to the children, then that is the maternal mortality rate. So that's how you measure. Okay, so here let's say these are the various mortality indicators. There are a lot of them. Okay, you don't need to remember all of them. You should be able to give at least a few examples. Okay, so I have kept a few examples over here. So first one is the crude death rate. So death rate means the death of people in a certain year in a certain community. Like let's say the death rate of Nepal, okay, in the year 2022. Okay, so that way you can feel that. So that will be the number of death per 1,000 population per year in a given community. That means in 1 year, in that particular year, let's say in the year 2022, okay, in the year 2022, out of 1,000 people, how many people died? Okay, that is the crude death rate. So this is how you are measuring the death rate. That is the mortality indicator. And other is the expectation of life. Okay, right? Like yesterday when I taught you in the last lecture, I taught you about the physical quality of life index and the human development index, right? So there I had told you, okay, so there I had told you about the life expectancy at birth and life expectancy at age 1, right? I had taught you that. So life expectancy at birth means a newborn child, okay, a child is just born in this world, and now for how long he's going to survive. Okay, like I had given you the example, like suppose the life expectancy which is mentioned over here, okay, the average number of year that will be lived by those person alive into a population. Okay, so that means normally a person how much he survive. Okay, because there is nothing sure. A person can even survive for more than 100 years. A person can even die at the age, the newly born can die, or even at 20, 30, 40, at any age you can die. Okay, but most of the people, the average number of people, they are surviving up to what particular age? Okay, that is called life expectancy. So when I taught in the physical quality of life index, then I told you the life expectancy at birth is the person survives for what for how many years. Okay, like let's say if the life expectancy is 60 years, then the child would survive for 60 years. So life expectancy at age 1 will be the child will be surviving for 59 years. Okay, so that life expectancy is denoting the mortality. Okay, that is helping to understand about the death. So that is the life expectancy or expectation of life. And there is something called infant mortality rate. So infant means the children who are less than 1 year, 1 year of age. Okay, so the death of the children under 1 year of age in a given year to the total number of live birth means how many children were born that year, and out of them how many children died. Okay, so that is the infant mortality rate. So one of the most universally okay, few of your friends are joining. Okay, please be in time because this will again disturb the class. Okay, so one of the most universally accepted indicator of the health status, not only of the infant, but of the whole population and the socioeconomic condition in which they live. Okay, so let's say if the infant mortality rate is very high, so that is not only showing the condition of the infant, okay, because it is also showing the condition of the situation of condition of the socioeconomic condition in which the people are living, right? Because what might be the cause of the infant mortality, right? Because there can be the lack of nutrition, there can be the lack of proper hygiene, proper sanitation. There are a lot of factors over there. Okay, so this is infant mortality rate is one of the universally accepted indicator. And other, there is the child mortality rate. So when you see child mortality, then the children from 1 to 4 year only will be covered over there. Okay, the infant are not covered here. So here you can see the difference in the infant mortality rate. The child till 1 year, the recently born child to 1 year of age are included here, whereas in case of the child mortality, the infant are excluded. Okay, keep that in mind. The infant are not included here. So you will be including the children from 1 to 4 year of age, okay, in a given year per 1000 population. So this has a formula. So when you see the child mortality rate, then you have to write the formula: number of death at age 1 to 4 year given by total number of children 1 to 4 year into 1000. Okay, so that will be a child mortality rate. So let's say if the child mortality rate is very high, okay, so what will that signify? What will that help to understand? So there is the inadequate maternal and child health services. There is a very low immunization coverage. Okay, because when the child is recently born, okay, there are a lot of immunization that he has to take. Okay, and most of that is given free of service by the government. So that also you need to know. Okay, the immunization schedule of Nepal, of the government of Nepal, you should know that. So there are a lot of them, okay, because those immunization against those diseases are necessary, because those diseases are very, very fatal, okay, that can cause the death of the children. So whenever there is a low immunization coverage, okay, there is the BCG vaccine against the tuberculosis, there is the MMR against the measles, mumps and rubella, there is the influenza vaccine, okay, there is the pneumonia vaccine, there are a lot of vaccines over there. So when there is a very low coverage, the government has provided free of cost, okay, but the coverage is very low, then at that time there is a chance that the child can die. Okay, and even the maternal and child health services, if they are not adequate, okay, then that can also cause the death of the children. So this is how the mortality rate will indicate the reason. Okay, so under 5 more proportional mortality rate. So now when you say under 5, okay, so now in this you have to include the child mortality rate as well as the infant mortality rate, because when you say child mortality you did not include the infant, but here when you say under 5 proportional mortality, you have to include the infant as well as children. Okay, note that. And other is maternal mortality rate. So normally whenever we are calculating any rate, okay, the first thing we do is we have two things, right? We have the numerator and then we have the denominator. Okay, so can anyone say here what is the difference over here in the maternal mortality rate? Because normally whenever we keep the numerator and the denominator, okay, the numerator, like let's say I told about the infant mortality rate, right? So when I told infant mortality rate, I told in the numerator it will be the number of death of the infant and divided by total number of live birth, means how many children will born. Okay, so the numerator is a part of the denominator, right? But now even when I said child mortality rate, so here also the numerator is number of death at age 1 to 4 year, and the denominator is the total number of children in that particular age group, right? So that is the child mortality rate. And even in the under 5 also it's the same, but here in the maternal mortality rate you have to understand, it is very, very important. Okay, there is something different. Can anyone tell me here? Because normally when we understand maternal mortality rate, okay, I give you the formula, tell me I'm right or wrong. Okay, so maternal mortality rate means number of death of the mother divided by the total number of pregnant mother. Am I right? Can anyone tell me? Dipshana, are you there? Can you unmute yourself? Dipshana?
Yes, ma'am.
Okay, can you tell me, am I right? I told you the formula of maternal mortality rate, okay? The number of death of the pregnant mother, the number of death of the mother who have delivered the child divided by total number of pregnancy into 100 or into 1000. Am I right? You know, you can say whatever you think, okay? You can think I'm right or you can think I'm wrong, but just give me the answer, Dipsana. You hear me, right, Dipsana? Can you answer that? Please don't take too much time.
Ma'am, it's a number of maternal deaths by number of live births into 1 lakh.
Okay, so okay, thank you, Dipsana. Now you mute yourself. So everyone listen carefully, okay? There is something different here. In all the cases, in all the rate we have read so far, okay, and in future also, whenever we read that, the numerator will always be a part of the denominator. Okay, but here in the maternal mortality rate, just understand it is quite different, because we are talking about the mother here, right? So the numerator constitute the number of death of the mother who give birth to the children. Okay, but in the denominator, the mother will not be in the denominator. Okay, in the denominator it will be the number of total live birth. Okay, this is, please note it down, this is very important. Okay, because see, when we keep the number of pregnant mother, okay, because here we want to see out of the total number of live birth, means out of the total pregnant mother, how many mother actually delivered the child. Okay, so that way we are not keeping directly the total number of pregnant mother, but we are keeping the total number of live birth. Okay, because if we keep the total number of live birth in the denominator, then how many live birth will be there, so that much only mother will actually give birth to the children. Okay, that's why it's different here. And other is disease specific mortality rate. So when you say the cancer specific mortality rate, then you can, then again now numerator will be the number of people who died from cancer divided by total number of people who were affected from cancer. Okay, so that way, and again the number of death from, let's say, accident. Okay, so it will be the same case, the number of people who died from accident divided by total number of people who actually had the accident. So that way we always keep the rate. So this will help you to understand the death rate. So now when we go in the morbidity, okay, so I told you mortality and morbidity is different. Mortality means death. Whenever you die, then that is mortality. Okay, and other morbidity means when you are ill, when you are not well, then that is called the morbidity. So how are you going to examine the morbidity? Okay, so you will see the incidence and the prevalence of a disease. Okay, like let's say you want to see the prevalence of the hypertension in the community. Like let's say the prevalence of hypertension in Kathmandu is, let's say, 50%. That means out of the total number of people in Kathmandu, 50% of the people are suffering from hypertension. Means they are not dead, but they are actually having that disease condition. Okay, so that is the morbidity indicator. And even in case of the dental caries also, dental caries is also not mortality. Okay, can anyone help me to say what is the mortality condition of dental caries? Jinnat, are you there? Jinnat?
Yes, ma'am.
Please unmute yourself and say me the answer. Okay, what is the mortality for dental caries? Dental caries is morbidity or it is mortality? If you are having dental caries in your tooth, okay, it is morbidity. So what can be the condition of mortality? When can it be mortality? You can say the answer, Jinnat? Okay, mute yourself. So see, now when you are having dental caries in your tooth, that is morbidity. Okay, but when you happen to extract the tooth, because let's say your tooth is hopelessly carious and you have to extract that tooth, then the tooth loss will be, the tooth after the extraction, the tooth is not there, so that will be your mortality. Okay, so that is for the dental caries. But here we are coming in the medical condition. Okay, so attendance rate in the OPD or health center means how many people visited the OPD or how many people visited the health center. So that will again show how many people were actually sick, because the people will visit the hospital only when they are sick, right? So the attendance rate in the hospital, attendance rate in the OPD, okay, admission, readmission, and the discharge rate. So see, again, when admission and readmission are very high, then that means there is a very high morbidity. But now when the discharge rate is very high, then again now that will show the morbidity is decreasing, right? Because see, whenever in the present context also we are seeing in the COVID scenario, right? When we see when we read the news in the Facebook or in whatever online newspaper, then we see that, okay, so the admission rate of COVID cases are increasing in the hospital. So again, that will show that the number of cases, the morbidity of COVID-19 is very high. But now when recently the cases are decreasing now, people are saying that there are very few cases in the hospital, and there is a high, comparatively there is a high discharge rate. So again, that will show that the morbidity is decreasing. Okay, so these are the indicator that will show the morbidity. So duration of stay in the hospital, and suppose you are not going to the hospital, you are taking the medication and you are sitting in your home. Okay, so at that time your attendance rate will not be there in the hospital, and your your admission in the hospital will not be there. So at that time, the absence from the work, the spell of sickness, okay, so this will indicate your morbidity, like you are not present in the class. Okay, so I took the attendance and you were not present, that means you were absent in your class. So next time when I asked you, then most of you will be saying that we were not well. Okay, so that absence from the class also will show your morbidity. So this is how the morbidity indicators are. Okay, so other is the nutritional status indicator. So what are the indicator that will show whether you are well nourished or not? Okay, so normally in the school children, okay, the height, weight, and the mid-arm circumference are measured. Okay, so there is a certain for a certain age, the child should have a certain height. Okay, and for a certain age, again, the child should have a certain weight. Okay, so these are called the anthropometric measurement. So if the child are having according to the normal values, then they are said to be well nourished, otherwise they are not. Okay, and even recently born child also, we normally, whenever a child is born, people we normally note down, okay, in hospitals we note down what weight the child was born with. Okay, so 2.5 kg is said to be in the border. So whenever the child is less than 2.5 kg, then the child is said to have low birth weight. That means the child was not, maybe the child could not get the proper nutrition when the child was inside the mother's womb. Okay, so that is indicating the nutritional status. So other is the disability rate. So that will supplement the mortality and the morbidity indicator. So here we have something called Sullivan index. So in Sullivan index, the formula is life expectancy, means how much years a person is expected to survive, minus the probable duration of the bed disability. Okay, so for how long he was disabled in the bed. So that is called the Sullivan's index. And other is disability adjusted life year, that is called DALY. And you can get in the MCQs also. Someone, okay, please be there in time. Okay, I'm saying the same thing. Okay, it's almost half class, and okay, now so there is disability adjusted life year. Okay, so disability adjusted life year include the two things: years of life lost and years of life lost due to disability. Okay, so these two things, you add it up and then it becomes the DALY. So what is years of life lost? It is calculated by the number of death at each age multiplied by the expected remaining years of life and the year lost due to disability. Okay, see, someone is entering again. This is not good. How many times I'm going to interfere? Okay. So this is DALY. Okay, so one DALY is equal to 1 year of life lost. So this is important from the MCQ point of view. Okay, so other is the healthcare delivery indicator. So it reflects the equity of the distribution of the health resources in different part of the country. So how the government has distributed the health care. Okay, how there is the how the healthcare services are delivered throughout the country. That is the healthcare delivery indicator. For example, doctor population ratio. There is something called dentist population ratio or doctor population ratio. Okay, that means for how much of the population, how many dentists should be there. There is an ideal one given by World Health Organization. Okay, so whenever you calculate the total number of doctors in the country, and then you also know the total population of the country, and then you calculate the doctor population ratio, and then you see that whether it is according to the WHO recommendation or not. If it is not, then of course the doctors are not well distributed throughout the population. Okay, and there is something called population bed ratio. Like, see, whenever they are going to construct a hospital, okay, and they are going to take the affiliation, or maybe even the medical colleges or the dental colleges also, whenever they have to get the affiliation, and whenever they have to get the license to open the hospital or open the clinic or open a medical or dental college, then there is a certain requirement, okay, that there should be a certain number of bed in that hospital. So why is that? Because it is to fulfill the requirement of the people. Okay, opening a hospital will not be enough. It should have the total number of bed also over there for the patients, right? So population bed ratio, population per health or sub center, population per trained birth attendant. So this shows the delivery of the healthcare services. Sorry. Okay, so now we have the so now you see, now the healthcare are delivered to the people. So now it is not necessary that the people will be utilizing those services. Okay, so there is another indicator called the utilization rate. So again, here I told you the government has given the free vaccination schedule. Okay, there is something called national immunization program. You can NIP that you can see in the internet. Okay, and I told you it is important for you. You should know all the vaccines, in which age the vaccine is given. Okay, for what age of the child, in which site, and against what disease. You should know that. It's better you download it and you keep it, or you make a note of that. Okay, so the government of Nepal has provided up to the child will be getting the vaccination for almost let's say up to 5 years of age. Okay, and there are many other nutrition programs also for the children under 5 years of age. So government has provided that services, but it's the people who have to utilize that. So now to understand whether the people have utilized it or not properly, so there is another indicator called the utilization rate. Okay, so in the first example you see here the proportion of infant who are fully immunized against the 6 EPI disease. EPI means expanded program on immunization. Okay, so now the government has given those services in all the primary healthcare center, in the health post, but now there is something called Nepal Demographic Health Survey. Okay, I have told you many times in the class also that in the Nepal Demographic Health Survey that is conducted every 5 years in Nepal, and also there are many other survey. Okay, that, and there is a Department of Health Services in Nepal which also gets the annual report. Okay, it has got the annual report every year. You can see even in the internet also. So there you will be seeing that annually how many children are dying. Okay, what is the infant mortality rate, what is the child mortality rate, and these all things will be there, and how many children are getting the proper immunization, how many mothers are receiving the services of the maternal and child health services, how many people are actually utilizing the family planning services. So that report are reports are necessary to see the coverage, or like to see what extent of the people have actually utilized those services. Okay, so these are the indicators of the utilization rate. And as I told you, in the health service delivery, okay, in the healthcare delivery indicator, we know there is population bed ratio or population per health center. So now, okay, the hospital has the total number of bed as per the requirement, but actually what is the bed occupancy rate? Okay, so that will show the people are properly utilizing or not. Another is indicator of the social and mental health. So we all know the definition of health. Okay, health is not only about the physical and the physical health only. It's not only being healthy or being free from the disease. There are many aspects of health. There is the social and the mental aspect also. Social, mental, spiritual, emotional. Okay, there are a lot of dimensions we studied last time. So when you want to see the social and mental health, so how will you know? Because social and mental health cannot be examined. Okay, there is nothing called no parameters for that. So how do we know that? So see, now if there is the large number of suicide happening, there is a large number of homicide, there are a lot number of violence, okay, family violence, the road traffic accident, alcohol, drug abuse, smoking. So this all will show that the person are not socially and mentally healthy. So when such number of cases will increase, okay, so that will indicate that social and mental health status of a certain community. So these are the indicators. So other is the environmental indicator. So again, we also read about the ecological concept last time, if you all remember, right? So we studied the biomedical concept, in which we studied that the health is, the person is said to be healthy when he is free from the disease. So there we studied about the mortality and the morbidity indicator. So another was the ecological concept, which showed that the person is healthy when there is a balance between the person and the environment. So now again, environmental indicator is also very, very much necessary that way. Okay, so what constitute the environment? Whatever is around us, the air, water, soil. Okay, so whatever is around us, that's the environment. So whenever there is an increasing air pollution, water pollution, radiation, solid waste, okay, there is excessive noise, and there is exposure to toxic substance in the food or the drink, then these are the environmental indicator. This will show the certain population in that area that will indicate towards the health status. Okay, so that is the environmental indicator. And other is the health policy indicator. So here, that is the allocation of the adequate resources, the proportion of the gross national product spent on the health services, health related activity, and the health resources. So last time I told you there is something called gross national product and gross domestic product. Okay, and in the gross national product, that will include the income, okay, from the people inside the country as well as the people of Nepal. They should be Nepali citizen who are staying outside the country. That is the gross national product. So the proportion of gross national product which is spent on the health services or health related activity, that is the health policy indicator. Sorry. So now we come in another topic, that is the concept of disease causation. So again, there is a lot of confusion over here. Okay, so you all will be asked the question concept of health. Okay, so when you will be asked the changing concept of health, then you have to give the answer biomedical concept, ecological concept, psychosocial concept, and holistic concept. You have to answer it that way. And again, you can be asked the concept of disease causation. Okay, so don't get confused. So when you will be asked the concept of disease causation, then you have to give these all, but you have to write about this all in short. Okay, because see, normally you don't get the question of very long marks. You either get the question of 3 marks or 2 marks or 1 marks. The questions will not be exceeding more than that. So when you will be asked if a lengthy question, concept of disease causes, and then you enumerate all of these and write 3-4 lines of each. Okay, but you don't get the question that way. Actually, sometimes you will be asked normally to write about the germ theory, or you will be asked to write about the iceberg phenomenon. So that way you will be asked the questions. So this is important again for the viva point of view. Okay, and there is again another concept. Okay, there is the concept of changing concept of public health. So again, these 3 might confuse you. Okay, so you might note it down. So now let's come in the first concept, that is the germ theory of the disease. Okay, so germ theory of the disease, it is similar to the biomedical concept. Okay, so here Dr. John Snow, he contributed to the formation of the germ theory when he traced the source of 1854 cholera outbreak in the Soho neighborhood of London. Okay, so there was a cholera outbreak. So at that time, the people, they were not much familiar about that. Okay, the people suffered from cholera, and at that time, Dr. John Snow, okay, he's an epidemiologist. Then what did he do is that, so he went in that area, okay, and then he traced those areas which were actually the people who were actually suffering from cholera. Okay, because in a certain locality, all the people were not suffering from cholera. So he wanted to find out the cause of cholera. So there is something called the shaded map or spot map. Okay, that will come later in the biostat also. I'll be teaching you over there again. This thing will come again over there. Okay, so for now, just understand, he got a map of that area, okay, of the Soho neighborhood, and then what did he do is he just traced those areas, okay, where the people were suffering from cholera, and then he tried to find out the region. And what he found out was that he saw that those people who were getting the water from a common source of hand pump, okay, the people who were drinking from the common hand pump, those people only were suffering from the cholera, whereas those people who were not drinking from that hand pump, they were not suffering from cholera. Okay, so now he found out that the hand pump water, okay, so that might be the cause of the cholera. So when he examined the water of that hand pump, then the Vibrio cholerae, okay, the causative agent of cholera was found out. So that is how he gave the contribution to the germ theory. That means germ theory means it is a monocausal. Okay, monocausal means there are only 2 things. There is the disease agent and there is the human being. This germ theory will not include the other aspect. It will not include the environmental aspect. Okay, so that is the main limitation of this theory. That's why it is criticized and another theory came into existence. Okay, because see, now here in the current context also, let's say the disease COVID-19. Okay, I give you the example. COVID-19 is a disease, but not all of the people who will be exposed to the source of COVID-19 will be actually having that, right? There is something, and there are many other factors also there. So that is the main limitation of this. Okay, because it is not only the presence of a disease agent is not only sufficient to cause the disease. Okay, the work of Koch and Pasteur revealed that the prevailing health problem were the product of the living organism. So isolation of bacillus causing tuberculosis and identification of organism from 1880 to 1900 gave rise to the idea that each disease had a single and specific cause. So again, there is something called disease agent and there is human being. So whenever they both are exposed, it causes the disease. So that is the main thing about the germ theory. But there is a limitation that it led epidemiologists to take only one sided of the disease causation. But we all know that it is not only the host and the agent, but there is something called environment also. Okay, so that is the limitation. So see, it could not explain why not all exposed to the pathogen become ill. Okay, because all of the people they are exposed in a certain area. Okay, but all of the people will not develop the disease. So that is the main criticism for this theory. So that is why, okay, another concept came into existence that is called the epidemiological triad. Because when we see the germ theory, there is the role of only the host and the agent. The host is the human and the agent is the disease causative bacteria, viruses, fungi, okay, whatever is there, that is the agent. But since there is the environmental role was explained in the germ theory, so this role of the environment is further explained by the epidemiological triad. Okay, so you have to understand this. There is the host, there is the agent, and the environment. So because of the interplay, because of the interaction of all these three agents only, the person will suffer from the disease. Okay, so you might be in the past, okay, you already have got the short note on the germ theory, and many times you all are also asked to write the short note of the epidemiological triad. And I have been telling you this chapter is very, very important. Okay, all the topics in this chapter are equally important. So here, what is agent? Okay, so agent is an organism or substance or a force, the presence or lack of which may initiate a disease process or may cause it to continue. Okay, so whenever we say agent, don't understand that agent can always be microorganism only. Agent can be an organism, it can be a substance, or it can even be the force. And there is another thing, the presence or lack. Okay, that means the presence of agent will cause a disease. Okay, we understand that. The presence of a bacteria will cause a disease. So we understand that. But the lack of the agent also can cause the disease. Okay, for example, here the nutrient agent. Okay, nutrient agent is protein, fat, and carbohydrate. So the deficiency of the nutrient agent means the lack of the nutrient agent can also cause the disease, right? The lack of vitamins can cause many diseases like scurvy, beriberi, okay, and there are neuropathic diseases are there, and the deficiency of the protein and carbohydrate fat can also cause the kwashiorkor and marasmus. So just understand this proper definition. Okay, whenever you will be asked agent, don't say that only the presence will initiate the disease. You have to understand the lack also can cause the disease. So the complete definition is here. Okay, so when we classify the agent, it is of two types. The agent can be living agent, it can be non-living agent. So whenever we talk about the living agent or biological agent, then those can be bacteria, virus, fungi, and parasite. Whereas when we come in the non-living agent, then that can be the nutrient agent like protein, carbohydrate, fat, vitamins, mineral, okay, and then that can be the chemical agent, and that can be either the physical agent. And when we come in the chemical agent, that can be the external, which is external to us, like the lead, arsenic, and dust. Okay, so those can again cause the disease in the human. And other is internal, like urea in case of the renal failure, ketone body in the diabetes. Okay, and in physical agent, atmospheric pressure and temperature can be there, because again, whenever the pressure is very high or the pressure is very low, again it can cause the disease. It can affect the human being, the body of the human body, right? And like, let's say if the temperature is very high or temperature is very less, again it can affect the human body. So the host is the man himself. Okay, so the characteristic of the human being that determine how he react to the agent in the environment are called the host factor. So there are different host factor, okay, which will predispose the human being to a certain disease. For example, in the demographic characteristics, okay, we have the age, we have the sex, we have the ethnicity. So when we come in the age, okay, let's give the dental example. So whenever there is a small child, okay, if it is a child, then we can say that the child will be susceptible to the nursing bottle caries or to the rampant caries or the early childhood caries. But whenever it is an old person, then the person can have the root caries. Okay, so that way this age factor is actually predisposing that person to have the disease condition. Okay, and when even you say about the medical condition, we can say with the increase in the age, the person will be susceptible to develop the hypertension, okay, cardiovascular disease and diabetes and cancer. So those are the example for the age. And when we come in the sex, okay, the same thing. Whenever I'm taking the case history in the department, I ask you the importance of sex, right? I ask you the importance of age, and it's the same answer you give to me. So in the case of sex also, it predisposes the person to a certain disease. Like if he is a male, then he may be involved in tobacco habits, okay, and alcohol. So because of that, he may be susceptible to premalignant conditions, or he may be susceptible to cancer. So that is in the sex. And if it's a female, again, she can be more predisposed, she can be more susceptible to the lichen planus, okay. So those conditions are there. And regarding the ethnicity also, there can be many diseases which are found in different ethnic groups, okay. It's not because of being in that particular ethnic group, but because of maybe because of the various cultural practices they may be having. And other in the biological characteristics, so again, genetic background. So genetic background included those diseases which are hereditary in nature, okay. The mother is having, the father and mother both are having the hypertension, so of course the child also have got very large chances, he has got the major chances of being hypertensive again. So that's in the genetic background. And there are many other chromosomal anomaly diseases also, right? And other is the nutritional status. Again, if the person is well nourished, he may not be having the disease. If the person is having the very poor nutrition, then again he can have a lot of oral as well as the general manifestations of the diseases. And again, another thing is called the immune status. So this explains why all the people exposed to a certain agent, all of them, why they don't develop the disease, because there is something called immunity, right? So when we talk about the immunocompromised people, right? So let's give the example of HIV/AIDS. Okay, so we say that HIV/AIDS is a killer, right? The person who is having AIDS, the person ultimately dies. The person does not die of HIV/AIDS. Actually, he dies because HIV/AIDS will lower the immunity. Okay, the name itself is saying human immunodeficiency virus. So this virus will lower your immunity. So when you have got very low immunity, so you will be the easy victim, okay. You will be easily suffering from maybe pneumonia, or maybe tuberculosis, or maybe any other diseases which can affect you because you have got a very low immune status, okay. So the people of HIV, they may die because of cancer. The people of HIV, they can die of tuberculosis. The person of HIV, they can die because of pneumonia, okay. So that is main factor, that is the immune status. Okay, and other is the socioeconomic characteristics. So again, the social class, religion, education, marital status. So these all also will determine the disease. Okay, you all can think of the example on your own, and living habit, food habit. Okay, so these determine whether the host will develop the disease or not. So there is another thing called the environment. So that is the source or reservoir of the agent. Okay, where do you find the agent? So it's present in the environment. So it is the environmental factor that will actually cause the interaction of the agent and the host. Okay, so we have three environment. Mainly, we have to understand there is the external environment and the internal environment. Okay, so external environment is whatever is around you. That is the external environment, and the internal environment is the one which is present inside you, inside your body. That is the internal environment. So in the external environment, we have the physical environment that include the solid, liquid, gases. Okay, so the air, pressure, temperature. So those all are the physical environment. And in the biological environment, we have all the living being that surround, all the living being which that can be animal or that can be plant, which is surrounding the human. Okay, and other is the social, means the social and the economic factors. Those are the social environment. So the internal means inside you, and external means which is present outside you, also called the macro environment. So the epidemiological triad is useful for understanding the infectious disorder, okay, and it is very less useful with respect to the chronic and degenerative disorder such as stroke, arthritis, and heart disease, because here whenever the person is suffering from the heart disease or because of the stroke, then the environmental factor is not there. Okay, then there is another concept for that. We have the multifactorial causation, and we have the wave of causation for that, whereas the epidemiological triad is important to explain only the infectious disorders which are actually caused from the environment. Okay, so now multifactorial causation. So from the name you can understand multi and factor means there are there can be many factors which can actually cause the diseases. Okay, so that is the multifactorial causation. So if you say cancer, okay, Mahavir, can you unmute yourself? Mahavir, do you hear me? Okay, Karuna, can you hear me?
Yes, ma'am.
Okay, can you answer me? What can be the cause of cancer? Tell me all the causes you know for cancer.
It can be the genetical mutation that occurs,
Okay, then the
and
main thing you are missing the main thing. Okay,
tobacco
whenever
chewing.
okay, the first thing whenever I say cancer, you have to say tobacco, right? Because that is the most important one. Okay, tobacco. Then
Smoking,
all of those comes in tobacco, right? Smoking and smokeless, all of that is in tobacco. Okay, tobacco is one thing. Then alcohol, right?
the yes, ma'am.
Tobacco, alcohol, and then you told genetic and others. Because I
The
told you,
radiation.
okay, radiation. I taught you all, no, epidemiology of oral cancer. So I taught you about the tobacco. I remember you all were there. So what can be the other causes? Do you remember other causes? Nutrition. Is nutrition the cause of cancer? Lack of nutrition?
Um,
Lack of antioxidant, lack of the, if you are not having the proper antioxidant in your diet, okay, then again you can suffer from cancer. So nutrition is also one of the cause of cancer, okay. And other non-healing sore, if you have got non-healing sore, the wound which are not healing, okay, that can also ultimately convert into cancer. Okay, thank you. Unmute yourself now. So see, what I mean to say is, whenever you say cancer, it's not only tobacco that causes the cancer. Okay, there are a lot of factors over there. Similarly, regarding the coronary heart disease or cardiovascular diseases also, okay, there are many factors. Excessive of fat intake. If you are having a diet which is rich in fat, okay, or if you are a smoker, if you do not have the proper physical exercise, okay, you are having a sedentary life, you are just sitting, you are just sleeping, you are not doing any physical activity, so that will also predispose you to the coronary heart disease. So what I mean to say is, whenever a disease has many factors associated with it, okay, so that is the main thing which is explained by multifactorial causation. Okay, so as I told you, the infectious diseases, the diseases which are communicable, okay, those are explained by the epidemiological triad and the germ theory. Okay, but here those because of the increase in the civilization, okay, because of the development in civilization, okay, what happened is that those infectious diseases, okay, they are decreasing. And at present also, if you see, okay, you see a very less number of cases of the communicable disease as you compare those with non-communicable. Because now, if you take the history of each and every person who are more than 40 years, okay, majority of them are suffering from hypertension, majority of them are suffering from this diabetes, okay, or cardiovascular disease. So why is that? Because that is the non-communicable disease, okay, that might have the many factors associated with it. It's not that a single factor is causing that. Okay, so that is so this concept, so why we need to understand the multifactorial causes, and means this concept offer the multiple approaches for the prevention of the disease. So when we know that this disease can be caused not only because of tobacco, like let's say cancer, okay, so we all know cancer is not only because of tobacco. So only quitting tobacco will not be enough to prevent the disease. You should take care of other things also, like as I told you, alcohol. So again, it's not only tobacco that you should quit, you should quit tobacco as well as alcohol. And as I told you, it can be because of the non-healing source. So whenever you have got any kind of wound in your body, or whenever you have any kind of ulcers in your oral cavity that is not healing, then you should be very careful and you should get it examined and treated in time. Okay, and like because of the lack of nutrition, so again now you should be very careful here again, because you should take those diet which are rich in antioxidant, okay, especially rich in vitamins. So those are the ones which are which act against the cancer, okay, which help you to prevent the cancer. So you can take the multiple approaches. Similarly, if you want to prevent the cardiovascular diseases from yourself from suffering from cardiovascular disease, then you should have a life full of physical activity, okay. And then you should quit smoking, you should avoid a high fat intake in your diet. So these are the multiple approaches you can adopt. So that is why understanding the multifactorial causation is important. And there is something called natural history of the disease, okay. So it is a key concept in epidemiology. So any of you who suffer from COVID in this time, any of you, can you volunteer to tell me who suffered from COVID this time? Any of you? No one?
Yes, ma'am. I
Who,
suffered.
who is it?
Shruti.
Shruti. Okay, okay, tell me. Okay, so now let's discuss about you. So before you suffered, so there was a certain stage called the pre-pathogenesis. Okay, when you were not affected to the COVID-19, right? So then, how did you come in contact with anyone who had COVID? And like, if you remember, or you don't know how you got it.
No, I don't remember, ma'am.
Okay, so maybe you had been around some people, okay, who were suffering from COVID. Because of that, you got that, because it's all because of the aerosol, right? So that was the pre-pathogenesis stage. So after that, okay, you got the COVID, and when you got the COVID, then the virus entered your body, then it started multiplying. So that stage was the pathogenesis. Okay, so after that, what happens? Then you suffered from a certain time, right? You had certain symptoms, you took rest, you take the medicine, and finally after how many days you recovered?
After 7 to 10 days, ma'am.
Okay, so now when you see in the natural history, okay, thank you, Shruti. So now when you see in the natural history, so what happens? The initial stage will be the pre-pathogenesis, when Shruti was not developing any symptom, when she did not have any disease in her body, she did not have the organism in her body. Okay, so then she got exposed in that certain area, maybe she got exposed to the certain people who were suffering from COVID, but she didn't know that. Okay, so and after that, now that a virus entered in her body, it started multiplying. Okay, then that is the pathogenesis stage began. And finally, after the pathogenesis period, then the other stage was recovery. Okay, the sequence will go in that way. First of all, pre-pathogenesis, and then pathogenesis and recovery. But in some of the cases, okay, like especially in the second wave, right? This Omicron is not so deadly. It's not effective so much. Okay, they are actually recovering. But if you remember, in the first wave, in the second wave, especially the Delta variant, okay, that was a lot of people were going in the ICU. They were suffering, right? So at that time, the sequence would go from the pre-pathogenesis to the pathogenesis, and even some people would die also. So it would not go to the recovery, but it would go to the death. Or maybe even some people who survived, okay, especially from the Delta variant, even they survived from that. They remained in the ICU for a long time, and after that they survived and they came out. But still, if you come across such people, and if you ask them, they will be telling you, after this, it has become so difficult for me to climb the stair, and it is very difficult for me to perform the physical activity also. I cannot I get breathless, right? So that is called the disability. So the disease can progress. Okay, when you see here, the disease can progress from the, you see this picture here. Okay, first of all, there is the pre-pathogenesis. So the person is exposed to the host, and the person is exposed to the agent in the environment. Okay, so after that, the agent will enter the body. Then there is a pathogenesis. So again, there can be the early stage, there can be the advanced stage, and then finally there can either be the disability. Okay, means the person will survive, but there will be a lot of disability in his body, and or the person, there can be the death, or there can be the recovery. So this is why you need to understand the natural history of the disease, okay? Because this will help you to understand at what point the intervention can be done, or maybe in the pre-pathogenesis phase itself, the prevention can be done, right? Because now we all know. So how are we going to prevent the COVID? So we should wear the proper masks. We should avoid the social distancing. Okay, so these all things are there. So that is the intervention which can be done in the pre-pathogenesis period. And in the pathogenesis period, there are a lot of symptoms. Okay, so you do the treatment according to the symptoms. So, and one thing is very, very important here. Okay, so when we say natural history of disease, then understand one thing: natural history of disease occur in the absence of the medication. Okay, so that is important for the MCQ point of view. If you will be asked the stage of the disease, okay, without the interruption, then you have to take the natural history of the disease. Because here, if you are not interrupting, then the disease will either cause the death, or either it will cause the recovery, or it will cause the disability. Okay, so it is important to understand the natural history for prevention and control of the disease. The earlier you become aware of the disease, the more likely you will be able to intervene and save the life. Okay, and other is the wave of causation. So when you see wave, what do we understand? Okay, wave means like the spider web. Okay, so the disease is also explained that way, that there are many factors, okay, which are causing the disease, but those factors can be interrelated. So again, don't be confused in the multifactorial causation and a wave of causation. Okay, in the multifactorial causation, there are many factors which can cause disease, but those factors are not interrelated. Okay, like this tobacco is causing the cancer. Okay, the non-healing sore is causing the cancer. The lack of nutritious food, especially in the antioxidant, that is causing the cancer. But these three things are not interrelated, right? So that is the multifactorial causation. There are many factors, but they are not related. That's why you are taking the multiple approaches to prevent the disease. But here in the wave of causation, just understand there are many factors, but those are interlinked. Okay, one of the factor may be interlinked with another. So if you happen to control one factor, so that will also help to control another factor, because the second factor is already connected to the first factor. Okay, just like the wave of a spider. Okay, so if you see the wave of a spider, and if you happen to cut one or two of the link, okay, then the link which is following that, the wave which is immediately following that, that also becomes weak, right? So it's the same thing. Removal of some of the factor is important, is maybe sufficient to control the disease as a whole. Okay, so now let's see the example over here. So in the dental example, the wave of causation for dental caries. So if you see here, okay, so whenever there is a malaligned tooth, okay, you have a lot of crowding in your tooth, crowded tooth and all. So whenever you have malaligned tooth, you will have the poor oral hygiene. Okay, so if you have poor oral hygiene, then again the carcinogenic microorganisms may be there, and then you can suffer from dental caries. And again, you see here again, because of the age, okay, increasing age, there will be a less saliva in your oral cavity. So whenever the saliva is less, then saliva plays a major role to prevent the dental caries. You all know that, because saliva has a self-cleansing action, okay, and saliva has got many antibacterial properties also. It has got the buffering action, okay, and whenever there is the demineralization similarly, even because of the lack of knowledge, they may also be taking the food which is actually promoting the caries, and again that can cause the caries. So you see here, there are many factors which are causing the caries, but that is actually interrelated, right? So if we are controlling one factor, then we can control the other factors also. So if you see here, given in your park and park, okay, but you can give the example of dental also. If you find this chart very confusing, then it's good even if you give this example for dental caries also, or maybe you can find some other easy example also. Okay, the example part you can write any, it's not necessary to write from the book. Okay, so here you can see change in the lifestyle, then plenty of food intake that can cause obesity, and that is called hyperlipidemia, and that can cause MI. Okay, or maybe change in lifestyle, then there is smoking, and again that can cause coronary occlusion and MI. So this way you can see a lot of things are there. There are so many factors here, right? Food intake, physical exercise, smoking, aging, stress, but all of them are interrelated. Okay, so this is the wave of causation. Okay, so now let's finish this here. Okay, so let's see what we studied so far. So today we studied about the indicators of health. Arsana, did you take the attendance? Arsana? Arsana, are you there? Okay, so all of you are hearing me? Ashutosh, can you unmute yourself?
Yes, ma'am.
Okay, so can you tell me the difference between the multifactorial causation and wave of causation? You can say even in Nepali also. Multifactorial causation and wave of causation. Can you tell me the difference?
Multifactorial causation means disease has multiple factors that may cause it,
Okay, then
and
and wave of
and
causation.
wave of causation means the one causation factor may relate to another, and the all will relate at once and cause a single disease.
No, it's not like that. All may not be related. Okay, like in case of, you should say strictly. Okay, in case of the multifactorial causation, those all the factors are not related. But here, in case of the wave of causation, some factors. Okay, some factors may be related to another. Okay, some of those factors may be interrelated. So if you control one factor, then that will ultimately help you to control the other. Okay, thank you, Ashutosh. Anjula, can you unmute yourself? Anjula Malla? Anjula? Okay, Monica? Are you there? Monica? Okay, Nandani, are you there? Nandani? Okay, Probin, are you there?
Yes, ma'am.
Okay, and tell me why is it important? Why multifactorial causation is important and why wave of causation is important?
Ma'am, according to previous theory, like this jump theory, only
No, don't go in the
few.
previous theory. No, don't go in the previous. Just tell me in one line, okay? What will multifactorial causation help you? How will it help you?